What people tell me is that the cost of health insurance is too high. Small businesses, independent contractors, just regular people are saying that they can't afford the increasing cost of premiums and health insurance, and it's got to come down. It's squeezing out people's ability to pay for other things, whether it's education for their children, even in some cases putting food on the table. It's more important than taxes, more important than anything else, I think, in this race, is bringing that cost down, because it leads to job loss. It's harder for businesses to hire people now that there's a mandate. So what I believe we have to do is create more competition in health insurance. You should be able to buy health insurance across state lines. I don't understand why that wasn't changed in 2006 and why it wasn't changed with Obamacare. But it absolutely needs to happen. We saw it happen with car insurance. As soon as people could buy and policies could be sold from out of state, the prices started to drop. And I think there needs to be some competition there. We need to lessen the amount of mandates as well. If you're asking people or telling people that they have to buy insurance, but then telling them they have to buy this Cadillac plan that has everything, and then we keep adding mandates as the governor did this year, it becomes unaffordable. I understand the business model needs for putting things into health insurance, but we got to look at the reality of what people can afford to pay. So there needs to be more choice for the consumer in terms of what they need and what they want if they're going to be required to buy health insurance. That's why people don't want to buy it. That's why some people would prefer to pay the tax. Not prefer, but they feel like they need to pay the tax because the costs are too high. We also have to deal with medical malpractice. It is the boogeyman in the room that nobody wants to talk about. It wasn't talked about in '06, it's not talked about in 2010, and as we move towards global payments, which is an option that I'm open to, medical malpractice insurance has to be part of that, reforming that. Tort reform has to be part of that. We're calling for a series of health administrative courts where you could set up a quasi-judiciary that could deal with these issues, so it's not just the trial lawyers trying to hit the doctors and this battle going on with the patient at the end of the day suffers. That issue is a big cost driver. It is an issue that nobody wants to address because everyone's got ties to the trial lawyers. That's why I think an independent candidacy is the solution to this problem, because I'm not tied to either party, I'm not tied to trial lawyers or not, and I'm not trying to hurt anyone, but I'm really trying to help the patient and try to keep doctors practicing here in Massachusetts, because we're losing primary care physicians, we're losing obstetricians, we're losing specialists who just can't deal with the high cost of medical malpractice insurance. It's driving them out of business, just like any small business. Doctors are businessmen and women, and they need to be able to survive the environment and not be taxed out or insured out or legaled out of the business. I mean, it's just common sense, and that's the approach I want to bring to the health insurance industry. I don't want to hurt it, because at the end of the day, it's a huge driver of our economy. It's a huge amount of employment in this industry, and we need to keep it strong, but we need to keep it affordable. And that's the key for me, is taking what was passed in '06, making it work better, giving people a choice, in some cases asking them to pay a little bit more, because we can't afford free health insurance for everyone because someone's paying for it, and it's usually the middle class, small businesses, or the industry itself. I think payment reform is an interesting concept. I've followed sort of the global payment dialogue as it's gone forward, and I think it is something that we should work on, something we should look at closely. But theory and reality are two different things, and it has to work in reality. It has to work with doctors and providers. It also has to work with patients. We can't just try to jam it down people's throats because it sounds good and it seems, again, in theory and on paper, to work. It's got to work in real life, because every time government forces reform on an industry, there are the law of unintended consequences that happen. People don't get the coverage that they need, or doctors or nurses or the medical profession can't provide those services given the fact that they're being squeezed down in their costs. It's very much like trying to deal with Medicaid patients. You're not getting fully reimbursed, so doctors and healthcare providers are doing what they have to do, which is just not accepting those patients because they can't afford it. They're not getting full reimbursement. So for the federal government or the state government to come in and overly regulate this, maybe like they've done with the fishing industry over the last 2 decades, will not work unless it is something that both parties and all parties agree to, and we can get some real practice. I'd like to look at pilot programs in different hospitals or with different doctors or provider groups to see if it works on a day-to-day basis before we take it global, as they say. I see the profession as the way I see most of the economy, which is a series of small businesses, and I think that this is a business and we have to respect it as a business. It's also a profession. that saves lives, treats the ill, and tries to make us better at the end of the day. And I want to help those people who have sacrificed a lot, spent a lot of money, borrowed a significant amount of money to make not only their lives better, but our lives better, and keep Massachusetts as the #1 healthcare provider and the #1 healthcare server in the country. We don't want to lose our position because we're trying to figure out how we're going to squeeze doctors, squeeze hospitals, make the numbers work. I believe I can do that. I have a series of successes in state government. This is a challenge that I want to take on and I want to solve so that we can continue to be #1, but do it at a rate that is affordable to the consumer and beneficial to the doctors.